Good morning, everybody. Thank you for this opportunity, sir. Visco expression in soft cataracts.
Okay, sorry, this was your topic. Sorry.
We all know that nucleus delivery is one of the important steps of surgery, and it consists of bringing the nucleus in the anterior chamber and nucleus delivery through the scleral tunnel. What we usually do is, once you have an adequate size rhexis and you have done a very good hydrodissection, you either use viscoelastic to prolapse the nucleus into the anterior chamber, or with your hydro itself you do, or you use a Sinski and a second instrument to gently coax the nucleus into the anterior chamber. And all this depends on the size and type of the nucleus, the size of your pupil, the depth of your anterior chamber, and the integrity of your zonules. If you are dealing with a pseudo-exfoliation, you won't be doing a lot of jugglery with the nucleus, but you would prefer that it comes out in one go. An adequate capsulorhexis is a must. Through the scleral tunnel, it can either be delivered in toto, that is through hydroexpression or viscoexpression, sandwich technique, or the fish hook technique, or with a smaller tunnel, it can be delivered by fragmentation, snare, wire vectors, bisector, trisector, or the tunnel phaco-fracture. So with viscoexpression, what you usually do is use lots of HPMC, which protects the endothelium against damage and preferred for soft cataracts. What you need is an adequate size tunnel, adequate pupillary dilatation, capsulorhexis of an adequate size 6 millimeters, and adequate viscoelastic removal, which is important because you should not, however, post-op rise in IOP. Sorry? Yeah. So this you can see is a very soft cataract, hardly NS1 to 2, and with a good capsulorhexis, you can either use your 26 gauge or a forceps, and hydrodissection is a must. You can see the wave going through, and once you do it in at least 3 or 4 quadrants, you can have the lens into the anterior chamber. A cushion of viscoelastic is important. You put viscoelastic on all sides, and then gradually, while pressing the posterior lip, you can have the nuclear material out. Yeah. Again, the wave of hydrodissection. Once the tip of the nucleus is out, you can use viscoelastic from the side port also to elevate the tip into the anterior chamber, and then gradually, with the help of a Sinski, rotate the nucleus out into the anterior chamber. Viscoelastic at the sides, between the nucleus and the endothelium, and then you can just gently press the posterior lip and have the nucleus out. This is a slightly harder cataract, but then again, all the procedures which we follow routinely, just have the nucleus into the anterior chamber, have a very good cushion of viscoelastic, use it liberally behind the nucleus also, so that the PC stays away, the iris stays in place, and then you can just gently remove the nucleus out of the anterior chamber. Be careful of the air in the syringe, because if you suddenly push an air into the chamber, there can be a danger of the PC rupturing. Advantages: short learning curve, your endothelium remains safe, AC is formed throughout the procedure, surgical instruments stay away from the PC and the iris, and PC tears are rare if you are very careful with your viscoelastic. Suitable for soft cataract, small nuclei. Size of the tunnel may have to be increased. There are chances of iris prolapse, and if you are on a ration of viscoelastics, this is a bit costly. Thank you all, and I invite you to Indore for the next AIOC. Thank you, sir.
For soft cataract, I think this is very good and safe technique, definitely. We all agree. But it should be for soft only. And your maximum incision will be 5 or 5.5?
5 to 5.5, sir.
5.5.
5.5.
And how much away from the limbus you give the scleral?
2 millimeters away, sir.
Straight or frown?
Frown.
Frown. Good. Good. I think it will be, for a soft one, I think it's a good one. Because soft, sometimes you struggle to bring out the nucleus from the bag and all that. So you just make it whatever small nucleus, mini nucleus, what you call it, and once that comes out, cortex also can come out, and then even cortex can be then washed by ACM or whatever. Now,